everyone, and welcome to today's Connect and Learn webinar. I'd like to begin by acknowledging the traditional owners of the land on which we meet today and pay my respects to their elders past, present and emerging. I extend that respect to Aboriginal and Torres Strait Islander peoples listening today or in the future. My name is Rebecca and I'll be facilitating today's webinar, which is called There's an App for That, the Which, Why and How of Smartphone Apps for Addictive Behaviours. This webinar is part of a series of Connect and Learn webinars designed to support AOD clinicians throughout Victoria. This webinar series is funded by the Victorian Department of Health and hosted by Turning Point. We do want the webinars to be interactive, so please ask questions via the Q&A function, not the chat function. The questions will be collated and answered by our presenters at the end. They will not be answering the questions live. Please be aware that our webinars are recorded and are later made available on the Turning Point website. We encourage you to stay to the end of the webinar and complete the exit survey when the QR code appears on the last slide or via email later today. A copy of the slides will be made available and will be emailed to you. I'd like to introduce our presenters, Professor Victoria Manning and Associate Professor Petra Staiger. Dr. Victoria Manning is a Professor in Addiction Studies at Monash University and Head of Research and Workforce Development at Turning Point. Dr. Petra Staiger is an Associate Professor in the School of Psychology and Deputy Director of the Centre for Drug Use, Addictive and Antisocial Behaviour at Deakin University. Thank you both so much for coming today. I'll hand it over to you.
Thank you very much. Thanks for joining us, everyone, on this virtual sort of journey right through the which, how, why, what, when, etc. of the use of addiction mental health apps. So first of all, we're going to be talking a little bit about who uses them, why clients really we suggest should be using them, what they offer, when can they be used, the evidence base, which apps might be suitable, and then how to use them in practice. So a nice journey right through that whole process. There are a lot of smartphone users out there, 2.5 billion of us, and probably counting thousands on a daily basis. We use them for work, entertainment, socialising. 2 to 3 hours a day is recommended, not more than that. Just sort of get a little guidelines set in there. And they allow us to perform daily tasks, achieve goals and, set calendar invites, etc., etc. About a decade ago, there was a real focus on the idea that smartphone apps will allow really a sort of revolutionary start to the use of digital interventions for health issues. And they were embraced by software companies, researchers and governments. And that has actually occurred. In a way, I think we've still got a while to go to really personalise some of them, but some of what we're going to talk about today will hopefully be really interesting around the sort of future of where that will go. And of course, COVID-19 has really accelerated that process of apps. So how many? We didn't really go out and count them, Vic and I, but there are a lot of mental health apps out there. 350,000, 90,000 new apps were introduced in 2020 just on its own. And it's estimated that there's about 200 a day that are being added, with very few removed. So it's sort of understandable in a way that, if you want to move to the next slide, it's understandable in a way that, people feel a little bit sort of overwhelmed about using them. And also it's another thing that comes up often when Vic and I have talked to people around and say, oh, but older people don't use them. It's just really something for younger people. And that's actually not the case. Nearly 3 in 10, and I would estimate probably more as time goes by, older adults will currently using one mental health app. And some of the common ones that we see people using, which I'm sure you'll be familiar with, is sort of exercise, counting steps or encouraging that walk for the day, nutrition, weight loss, sleep. There's a whole variety of mental health apps that people use, or wellbeing apps. But let's specifically focus now on addiction, mental health apps, alcohol and drugs, gambling, etc. There's a lot of apps out there, as you would know, and I guess really what we'd like to encourage as part of our presentation today is for you to sort of have a go at using them. And one of the reasons that we think they're really helpful is because they're accessible to a broad population. You don't need to be waiting necessarily to see someone. You can access them 24/7, and there's also just-in-time interventions, which Vic will talk about. Then they're anonymous, private, and we'll talk a little bit about the issues around safety and security as well. They're discreet. They also help you track your feedback. So one of the things that Vic and I've both heard around, that people give us feedback around, is people love the tracking. They like counting the steps, how much do they, how long do they sleep for, how many drinks do they have, and then getting that feedback is really important, particularly if it's normative. And as we all know, that whole concept of self-management is so important in client well-being and being able to sort of move through a recovery process, is to have a sense of, how am I tracking? How am I going? Okay, I'm not going so well this week, better next week, etc. So that whole concept of an addiction app is able to really facilitate that. And in particular, we'll talk with the whole influx of AI technology, we'll be able to do amazing things, I imagine, in that we haven't even thought about yet in the next 4 or 5 years, around the personalisation of smartphone apps. At the moment, they're a bit static, so they're sort of a bit, one size fits all, but over time that will change. And finally, they can support all stages of the treatment journey, and we'll certainly be talking about that so that you can get a sense of when you might use apps for certain times of a client's recovery process. So what sort of addiction mental health apps are there? There's sort of a lot of them. And so what we thought we'd do is sort of, I guess, clump them into 3 groups to sort of give you a bit of a sense of their content. So there's the first group, which we call the sort of medical devices or digital therapeutics. And these are apps that are linked to a broader managed healthcare system. AHS, for example, is a US-based app and was one of the first randomised trials around recovery. And we're not going to be talking about those. We don't tend to have as many of them in Australia for a whole variety of reasons, particularly because of the way the health service works. But we do have a lot of Australian developed health and wellbeing apps that are standalone. And we also have a lot that are focused on community forums. So when you're thinking about using suggesting a mental health app, we also thought it would be really helpful to sort of give you a sense of where you might use them in that journey that a person's going through. So identifying the need for support might be useful for a service that's at a primary care level, or really a service that maybe not focused on addiction apps, but a community health service where you're thinking, this person they're not quite ready for treatment yet, but perhaps an app might sort of move them in that direction. So that whole group 1 and 2 apps are really around assessment and identifying treatment readiness. Then there's the next 3 and 4 are more around providing either standalone or adjunct interventions or treatment support. And they might be around craving strategies. They could be around if you're on a wait list, having some really simple cognitive strategies, behaviour change strategies, etc., to be able to sort of support you, or working together with a alcohol and drug counsellor in informal treatment, and using that as an adjunct. And then finally, the last group are around post-treatment recovery support. So you might have a client going through rehab and they're abstinence focused, and there's a whole variety of tools which Vic will talk about in a minute. So now we've talked a little bit about the sort of why and when you might use them. So what's in them? There is a lot of different components of an app, but one of the key things that we've seen across most of them are these key behaviour change techniques, which we know is essential in alcohol and drug gambling work, which is goal setting, self-monitoring, and feedback, particularly if the feedback's normative. There's also a variety of additional things than that's in apps, and that's psychoeducation, craving management strategies, affirmations, motivational techniques, audio content, so people talking about their lived experience. I think is really important, being able to sort of encourage people to sort of say, okay, I can do this, and from someone who's done it themselves. And that's where some of those community forum apps are just brilliant. And these components can be used as standalone, as we've said, or they can work in adjunct. And I guess we're trying to get that message across that really you can integrate, and we'll talk about that a little bit more, or you can recommend them as a sort of standalone. So what's the evidence? So in 2019, my colleagues and I did a review looking at the previous decade of substance use apps that had utilised a randomised controlled trial. So these are ones with two groups, they've been randomised with some form of control group. There wasn't many that fulfilled that criteria, and I was a bit surprised. There was only 20. And of those 20, 6 of them showed some significant reductions compared to a control group. Now, that might sound a little bit bleak, but what I think we need to think about is that we're putting these poor apps into a pretty tricky situation, because some of the control groups were actually, like face-to-face counselling, or quite a substantial phone intervention, or just another app. So I think even though only the 6 out of the 20 showed some evidence base, there is, we need to keep that in mind. And the other thing we need to keep in mind too is that some of those apps were very complicated. And I think what we've learned, particularly in the last 4 or 5 years, is that you do want to keep the apps that you use with your clients fairly focused on a number of key strategies, rather than saying, here's 20 different things, see what you think. So, but we'll talk about that a little bit more later, or Vic will be. Talking about Vic, here she is talking about her review.
Thanks, Petra. So we actually did a review that was published last year. So subsequent to Petra's review, there was an additional 15 studies, another 4 randomized control trials. But we came, like most reviews, to very similar conclusions, that there's promising signals in terms of feasibility and acceptability and preliminary effectiveness, but they are largely open label pilot studies of alcohol and smoking apps, very, very few targeting other drugs. And that there's only a handful of sufficiently powered, well-designed RCT to date, and we tend to see mixed findings. But the level of evidence that we see emerging from these reviews shouldn't really discourage us from giving them a try. I mean, there is this paucity of methodologically rigorous studies, but the reality is, when we're talking about apps, they're unlikely to do harm. They may be ineffective, but at worst, usually they're delivering something digitally that has been tried and tested and is used, perhaps an evidence-based behaviour change technique. Some, of course, will argue there's an opportunity cost, because somebody may choose to engage in an ineffective app instead of consulting with a counsellor or an evidence-based online intervention. But in reality, the level of evidence that's required for apps is a lot lower than we'd expect to see with, say, medication. And you can see that from this example here. Click Therapeutics app in the US, Clicatine, has FDA approval, and this had a registered randomized control trial that was withdrawn due to there being considered sufficient evidence from an open label observational study of just 78 participants. However, it does pay to be mindful of some of the inflated claims that you may see. Reframe, I believe, is a bit of an example of this one. It costs around $20 a month. It supposedly uses a neuroscience-based program, but from what I can see, it delivers psychoeducational readings about alcohol's effects, as well as trackers of things like mood, stress, and motivation, check-ins and coping strategies. And there's an optional paid coaching for another $150 or so a month. This app claims that 91% of its users noted a substantial reduction in their drinking within 3 months. And that would be based on probably the app users who are most engaged with the program. And it's obviously lacks the precision that we'd typically like to see when we're talking about treatment effectiveness. So some examples of apps that aim to identify problems or increase motivation for help seeking or behaviour change include the Daybreak app, which is a product of Hello Sunday Morning. I'm sure many of you are familiar with this. It's an excellent app. It's part of Hello Sunday Morning, which is an Australian not-for-profit organisation, and it offers an online community for people thinking about changing their relationship with alcohol. So this has around 127,000 downloads, and it's free to Australian residents due to some Commonwealth funding, and it offers around-the-clock peer support plus access to resources. There's about 6,000 active members each month. I run smart recovery groups, and many of the participants in that group say they love this app, partly because there's always somebody that they seem to be able to connect to and to relate to in the middle of the night, or when there's very little else out there in terms of support. And it has some published findings from a study showing significant reductions in weekly standard drinks from around 40 at baseline down to 20. So that's halving of standard drinks. Psychological distress reductions, and improved quality of life at 1 and 3 months after using the app. And another one that's been built by Australians is called Lived, which you may have heard of. This is it's very similar in that it's very much about the sort of community of people learning from others who have lived experience by accessing audio content on what helped them. S-Check, this is another brilliant app. It's developed by clinician researchers at St Vincent's in Sydney at their stimulant treatment program. And it was really designed to increase help seeking among people who use methamphetamines. It offers information, self-monitoring, and support resources. They ran an RCT with around 200 people, and this showed that after using the app for about a month, there were double the proportion seeking professional help in comparison to a control group. They also found that for every additional 10 minutes that people spent using the app, that was associated with a half a day less use of methamphetamine use. The website says that it's meant to be available around middle of this year. So hopefully that's not too many months behind, but I think that's really going to be one worth checking out. Now, smoking may not be the primary drug of concern for many of the clients that access your services, but we should be doing all we can to support people to quit smoking. And this is an excellent app which offers all the usual functions: goal setting, progress tracking, community support, and links to quit lines. It has some excellent craving distraction exercises, and it's free, and it has some published data on its effectiveness from a pilot RCT with older adults who showed increased motivation to quit relative to a control group. Smoke-free is another great one with similar features. What I really love about this app is that it prepares you for the quit date, which we know is really important in smoking cessation. So it gets you to do your own research, your own homework, if you like. And that aims to build intrinsic motivation and commitment for quitting, draws very heavily on motivational interviewing and implementation, intention, or if-then planning tools. So it encourages you to develop your own strategy, such as, if I'm tempted to smoke, and then the action, I'll call my friend, or I'll repeat my mantra, not another puff. This one's free, and it's backed by some data from an exploratory RCT. And Grounded is one for people wanting to reduce or quit cannabis. This one's pretty basic. It has access to features such as goal setting, progress tracking, check-ins, rewards, and community support. It's not free. It costs around $8 a month, but so far there's no research evidence backing that one. But there's very few that are targeting other drugs. So moving on to apps that can be used to support people, perhaps whilst waiting for treatment or as an adjunct to formal treatment. Less is a really good one that's free. It's a simple alcohol tracker app. It offers goal setting and tracks daily consumption. It tells you how much money and how many calories you saved by not having those drinks. And it links app users to resources. But again, no clinical studies on that one to date. I Am Sober is similar in that but this one targets all addictive behaviours and it counts sober time to the second. This can be really motivating all the time. That clock's going up, but I have heard people say it's quite disheartening when they lapse and it has to be set back to zero again. But this app has some features that are available for free, and you can get more if you subscribe for about $15 a month for premium access. But again, there's no research on this app to date. Now, Swipe is one you may have heard of. It is one that's based on neuroscience that we developed here at Turning Point in Monash. It delivers cognitive bias modification, which is a form of cognitive training that retrains our automatic tendency to notice and respond to alcohol cues in our environment. Traditionally, it's delivered using a laptop and a joystick, where people are trained to repeatedly avoid images of alcoholic drinks and to approach healthier alternatives, usually non-alcoholic drinks. And over time, when you do that over and over again, the avoidance of alcohol becomes more automatic, or if you like, the default response in real life. Sounds really simple, too simple to be true, but there's now 7 double-blind RCTs showing that it helps prevent relapse when added to residential treatment to the tune of 8 to 13% relative to a sort of control group, what we call a sham-trained control group, up to 12 months later. And that includes some of our own studies. So we adapted the training so it could be delivered via an app and also personalized. So the user selects and swipes away the exact drink types or brands that they want to drink less of. And they select photos representing their goals or values, such as photos from their own phone libraries of their own children or their pets, hobbies, etc. And they're awarded points based on how accurately and how quickly they swipe in the right direction. Each training session lasts about 3 to 5 minutes, and they're prompted to enter their craving, drinking days, standard drinks, that sort of thing, each week through the app. So a couple of years ago now, we ran a study. We had about 1,300 Australians download Swipe and start using it. They all had an audit score of more than 8, and the mean audit score was actually in the likely dependent range, or just outside the likely dependent range. We asked them to do 2 sessions a week for 4 weeks and to report their drinking during the 4 weeks that they were training and 1 month after the training. So we had about 450 who did that, who actually completed the post-training questionnaires. And we saw a significant reduction in past week drinking from a mean of 5 pre-training to a mean of 4. And that was maintained at the 1 month follow-up. And we also saw a 25% reduction in the number of weekly standard drinks, or mean weekly standard drinks, from around 33 at baseline down to 25, so about 8 fewer standard drinks a week. As well as that, we saw reductions in alcohol dependence and craving, both pre and post training, but also immediately after each of the 8 training sessions. And those findings have been published. Until about 3 or 4 months ago, Swipe was available for free download to the public, but we've been funded to run a number of double-blind randomized controlled trials, one with outpatients, one with people in residential treatment, and we'll soon be recruiting to a large community trial where we will be testing essentially the personalized CBM against a sham-trained control. And if it's proven effective in those newer trials, we will endeavour to make the app available again. So there's also apps for gambling. Reset is one that's developed by clinician researchers at Deakin Uni, and it uses CBT and motivational interviewing within a self-directed interactive program, offering all the features that you see listed there. This one's free, and it has evidence from a published RCT showing that when it's delivered with or without a therapist guiding them, there were reductions in gambling behaviour and problems, psychological distress, and improved quality of life, with greater improvements seen when it was delivered alongside therapist guidance. So in terms of the apps that can support people post-treatment, there's lots out there that are really geared towards 12-step, lots of AA and NA type apps that focus on maintaining sobriety. Sobertool is a good one. It's one, again, it targets all types of substances. It's predominantly sobriety and abstinence, sort of a day counter and progress tracker. So it offers inspirational messages, relapse prevention strategies, and community support. So yeah, this one's probably going to be better suited to people who've either gone through withdrawal treatment or wanting to maintain a period of abstinence. It's very much focused on that relapse prevention, uses lots of CBT and 12-step theory and language. It is free and it is available here in Australia, but there's no research on that one to date. So after that whistle-stop tour of the apps that are available in Australia, or hopefully will be available again soon, what we've looked at so far are really those that we call pull interventions. They're those that are initiated by the sort of support is initiated by the user when they feel like they need support. And we will now take a quick look at some of the newer push intervention apps, which are those that are initiated by computer-based algorithms, determining when and how the user is offered support. They're also known as just-in-time adaptive interventions, as they can respond to individuals' dynamically changing needs to deliver the right amount and type of support when required and only when required. But essentially what they're aiming to do is to avert or prevent negative events such as a relapse or use, and to promote healthier or positive outcomes. They draw heavily on ecological momentary assessments, or EMA, which are essentially mini surveys or check-ins that occur multiple times a day, often at random times, to really monitor somebody's mood, stress, craving, location, social context, that sort of thing. And generally, where these deviate from, say, previous days' reports or average responses, or where they show patterns that have previously been associated with adverse outcomes, such as a risk of relapse, then based on a series of decision rules, it will deliver an appropriate intervention, for example, a craving management exercise. Wireless technologies like smartphone watches can integrate continuous mobile sensing to predict these phases of risk or vulnerability, to really capitalize on that window of opportunity to intervene. I will say, though, the evidence so far for just-in-time adaptive interventions is pretty mixed, and that was confirmed in a recent systematic review. And unfortunately, there's very few available here in Australia at the moment, but I think this is one, as Petra mentioned in the beginning, I think this is one area we're going to see accelerate in the next few years. One that is available for gambling is the Gambling Less in the Moment. And this is funded by New South Wales Government. At 3 random times a day, it asks the app users to rate their gambling urges, and it essentially calculates a cognitive vulnerability score based on how they rate their craving intensity, their self-efficacy, and positive outcome expectancies. So based on that cognitive vulnerability score, it'll deliver a CBT, or an ACT-based urge management activity, with the idea that will then prevent this escalation to a gambling episode. The type, timing, and the number of activities are tailored to the individual and their situation. There's another similar app called Gambling Habit Hacker, and both of these, I think, have been or maybe have now finished being tested in micro-randomized controlled trials, which are a really cool design for this type of intervention. Essentially, participants act as their own controls by receiving an intervention on some instances and not on others, and comparing those. But it is likely we'll see more apps shifting from active measurement, where one's prompted to rate their mood or their alcohol and drug use, for example, as you see on the left, that mobile on the left-hand side of the screen, to more passive or automated measurements, such as the one in the middle of the screen, which gives you physiological data or more objective data, in this case, heart rate variability, which could signal vulnerability to periods of use. And we'll start to see more with ecological geolocation sensors like the screen on the far right. In this case, it's detecting the app user's proximity to a pub or a casino, which would then prompt the delivery of a video message from the app user's family. There are already gesture recognition functions on some smartphone watches that can supposedly detect smoking movements or drinking movements. And of course, we now have transdermal alcohol sensors. So it's likely that in the next few years, we're going to see much more integration with these and other ecological momentary assessment apps that can passively track things like times someone's spending at home, places that they're moving to, their physical activity. Keyboard usage and content can be subjected to natural language processing and sentiment analysis using AI modeling to predict somebody's emotions, whether that's positive, neutral, or negative, and then deliver an intervention based on those. And just a word on ethical sort of considerations with these. It's important to keep in mind that when you are sort of consciously entering how you're feeling, your mood or your substance use into an app, you're probably much more mindful of where, that you are sharing that data, that compared to these more sort of continuous passive measurements, it's not always going to be front of mind that that data is actually being captured. So given some of the data breaches that we've had from major companies recently, like Medibank and Optus, you can understand why people may be hesitant to use apps which capture this sensitive information. A lot of them are free or cheap because the companies make money by selling your data to a third party. Reassuringly, Australia has some of the most stringent privacy and confidentiality laws in the developed world. Apps must comply with the 1988 Australian Privacy Act and should have International Organisation for Standardisation, or ISO, certification. However, clients can check what's stated on the App Store under the privacy section, which is usually at the bottom of the page on the stores. And ideally, they should be transparent about what data it is they use, how they use it, where it's stored, who it's shared with, and for what purpose. But of course, it's always good practice to read the privacy policy statements and terms and conditions. Some tips for maintaining privacy are to use a different, or perhaps set up a new email address for the purposes of signing up for an app if you have concerns about privacy, or use a pseudonym, and to use folders for thumbnails. Some of the apps, they're not so discreet in what they do, and you don't necessarily want them popping up on your home screen. So you can pop them into folders and use snooze or control options for those push notifications. And definitely don't ignore permission request notifications, because these can change over time. So when we put this question, when making an app recommendation, which of the following do you consider to be the most important, to some addiction medicine specialists at a workshop Petra and I did earlier this year, evidence-based came out as their number one criteria. And this is in stark contrast to the reality that most people are guided much, much more by App Store ratings and reviews. And it was interesting to see this recent paper, which found that mental health clinicians remain skeptical of apps because of not really knowing which ones are validated and which ones are affordable. What we really need is a directory of all these unregulated apps, or ones that others perhaps have accredited, or some kind of curated directory. But of course, that's difficult because it's an ever-shifting landscape with all these new apps coming on every day and new ones and older ones disappearing. But I did have a look at this eMental Health, or emhprac.org.au. There's very few addiction apps listed on there currently, but that may be one worth checking out. You may also hear the word SAMD, or the term SAMD, which stands for Software as a Medical Device. This is really where apps provide therapy or track symptoms, and must be regulated by the Therapeutic Goods of Australia, TGA, unless they are excluded based on the fact that they follow established clinical practice guidelines, that those guidelines are referenced, and that reference is clearly displayed in the app. And that's the case for many that claim to be offering CBT and MI, so they're exempt from regulation. But the vast majority of the apps that we've looked at today fall under that category of lifestyle or wellness, and so they're exempt in that they really just provide information or tools to manage a healthy lifestyle. So back over to you, Petra, to talk about how to integrate apps into practice.
Thank you, Vic. So Vic's taken you on a lovely journey around the use of apps at the varying different stages, and really linking those in. And as you probably gathered, and there was also some data that she talked about with the gambling app, is that if you integrate an app with your work that you're doing with a client, it's more likely to be effective. And so that's really something that we would be strongly recommending. There may be circumstances in your workplace where that isn't possible. And so some of those earlier apps that Vic talked about, which were around assessing or enhancing treatment readiness, would be a really useful sort of app to be recommending. So I guess from in terms of the sorts of ones you might choose, having a look at where the person is or where your service is on that treatment trajectory, looking at price and affordability. There isn't always necessarily a lot of evidence base on some of those apps, but I think they will increase. But the ratings are really important. And I know that sounds sort of odd, but one of the things with the issues with apps is the attrition. And so if if people are rating it high and there's good reviews from other people, then you'll be more confident that your client as well will find it useful and feasible. When you consider credibility of the app developer, that might be another way for you to sort of get a sense of the app. So if they're, you can go, when you go into the App Store, it'll tell you the developer, and then you can look at what else they've developed. Looking at ones that are developed by universities or government supported, one like the My Quit Buddy, or things from universities, or Daybreak, which are also government supported, or Swipe from and the Deacon apps, those types of apps, that they've got an evidence-based components within them, as well as probably RCTs. And also, if you're familiarising yourself with the app itself, then that's it allows you to be able to address any questions. And I think that's really important. It goes back to that integration. Have I mentioned integration before? It's really helpful for the client if you're able to answer some of those questions as well, and particularly some of those ones like the tracker apps and those sorts of things that actually allow you to allow them rather to track and get feedback, allows them to then talk to you about that in the sessions, and you can say, oh, okay, that's great. It's a sort of way, instead of them saying, oh, I can't really remember how many days I drank or used or whatever. But if you've got, oh, well, let's have a look at the app. What happened there? Oh, okay, on that day. It's a really wonderful tool for you to be able to utilize that in your practice. And so then that will then help with adherence, engagement. It's a little bit similar to, in the olden days, we used to sort of give people little pieces of paper of homework and those sorts of things. Now that there's an app for that. Sorry about that little pun. We move to the next slide. So, look, I hope that this presentation is really encouraging you to go and try out using some apps. We really think that they are important adjunct and part of treatment, whatever that treatment journey is. Even though at the moment the robust evidence is like, it's not like there's hundreds of apps that have had RCTs, but they're promising. And as Vic was saying, if they're not, as long as they're not doing sort of any harm, which most of them won't be, it's really useful tool for people to have. So they're good enough. And when you need to consider when in the treatment journey that someone might use them, but use some ratings and reviews also to give you a sense of what other people are saying. And of course, as we've already talked about, the self-monitoring and the progress is a really helpful. People love it. People get a real sense of achievement. And we know that ourselves, when we do that for any other sorts of, behaviours that we want to do change, whether that be sleeping or walking or whatever it is. So the tip is to integrate, have a go. And so we end by saying, go forth and apply them, apply them to your practice. So thank you very much. And we look forward to some interesting questions. And remember, it's also recorded.
Thank you both very much. I do have a number of questions for you. How do we know when an app is worth paying for?
Oh, well, I guess, there's no simple answer to that. Of course, it completely depends, I would say, on what you want it for. I would say I've downloaded hundreds of apps, especially over the last few years. And sometimes you read the features and what they tend to do is offer you assessments. But when you actually want the features, you've got to subscribe. So I think it's worth looking. That's when it is worth reading the app reviews to see, what people like about them. Because sometimes you may be paying for a feature that's available in a free app, But as Petra said, it's really the progress tracking, the goal setting and progress tracking are probably the most popular features, and then the connection to people with lived experience and other people on that journey.
Thank you very much. How do you keep people engaged in using the apps?
I'm happy to help with that question. I guess if it's a standalone app that you're recommending and you're not really going to be part of that process of working with the client utilizing that app, then it's really building some motivation and support around the use of it. And of course, hoping that the app itself has got some really nice motivational features in itself, because we know attrition is really an issue with digital interventions. But more importantly, if you integrate, and we know that there's very clear data now that if you're integrating the app into your practice and you're bringing it into the session and asking people about it and asking questions, and also I was thinking, Vic, when you were talking about the data security, that, when raising those questions and discussing before they leave the session. So, what are some, as if you were doing a motivational interviewing thing, what are some of the challenges? What are some of the benefits? And if people are concerned about the security, actually going into the developer with them and having a look at that, or also saying, okay, well, how about you create a new email address, etc. So actually working with the person to identify some of those issues and then helping overcome them.
Yeah.
Thank you so much.
And I was going to say, to add to that, and I think, encouragement from family members or carers or others as well. Essentially they help build motivation. They can be a source of inspiration, reading from other people who've faced similar situations, and also accountability. I think that's a big part, is that they can share that information with, say, it could be a treatment provider, a clinician, a peer worker, a family member. They can actually say, look, this is my last month's consumption, or this is how my mental health, my quality of life scores have improved, and being held, sort of being able to show that they've stuck to their goals can be really motivating as well, I think. So that's another way in which we can probably increase attrition, is by showing that we value the data. Other people value what's being put into that app in terms of how they're progressing.
Thank you. How do these apps fit with the idea of neuroplasticity, as in they appear to be keeping the consumer strongly focused on their negative behaviours and not strength-based or positive focused?
It's an interesting question. Do you want to go first?
Yeah. So I guess there's a balance there with any behaviour change, and I agree completely. You're needing to be having a strength-based approach. So you're wanting to sort of focus on, and in a way, I'm just thinking of swipe. How you swipe things towards you that are around happy things that you want to do, or healthy things, etc. So I guess the tracking bit, I understand what you're saying. The tracking bit is tracking things that are, things you want to reduce. But a lot of the apps will very much focus on community support, engaging with things that you are, wanting to do in terms of positive activities and that. So, and I suppose that's one of the things that's really important around apps, is choosing ones that work with how you counsel and the models that you use too. So that is a really important question to raise, and I appreciate it.
Thank you. Just a couple of our attendees have tried to download the Swipe app and had trouble and couldn't find it. Any suggestions?
Yeah, unfortunately, we had to pull it because we're running these other trials in Victoria. They're double-blind randomized control trials. So that means 50% of the people signing up for those trials will get a different version of the brain training, not the active version. And of course, we don't want people who get randomized in that condition to then have access to the active version, or really mess up the study. So we're hoping to complete those studies in the next, I don't want to say 6 months, but certainly within a year, we should have the results from those much more rigorous, because that was an open label trial with the Swipe trial before. When we have evidence, hopefully positive evidence from a randomized control trial, we'll make it available.
Thank you. Are any of these apps culturally appropriate for Aboriginal and Torres Strait Islander clients?
I wouldn't say at this point. I know that there are some apps that are probably being tailored to other minority, communities, but well, not minority, but Indigenous. But I just I don't know of any at this point. I think no, sorry, I'm just trying to track through all the different ones, but I don't know of any. Sorry.
No, I did see one recently. I can't remember whether it was an online platform or an app specifically. I think we can add that to the we can send out the information. I just can't remember the name right now, but it's a lot of them have been tailored for the assessment, so they may deliver, say, the audit and identify alcohol problems in a more culturally appropriate way than a lot of the existing apps. But in terms of interventions, yeah, I'm not entirely sure.
Thank you. Another similar question. Is there any recommendations for apps for cold populations?
Well, it depends really what you mean in terms of whether you're talking about different languages. And of course, that's the issue we have with apps. And this is the thing, is that you've either got two options. You've either got software companies who are wanting to actually use it as making money, or you've got government supported, university supported apps, and that's quite expensive to run. I know that in the mental health space there is, but the addiction space is probably a little bit newer than the mental health space. And I think there really would need to be additional funding to be able to do some of that, translational work and that culturally appropriate work, which I think is really important, but we're a little bit behind on that in the addiction space.
Thank you so much. Just a couple of attendees looking for particular apps that you may or may not be aware of. So apps for young people around vaping or, ceasing, and someone looking for an app for a 16-year-old using cannabis alongside ADHD and depression medication. Any suggestions?
I haven't looked at one specifically for younger people. I'm sure there must be some out there. What we're seeing in terms of engaging young people in treatment is for addiction, for substance use issues, is that there seems to be greater adherence, or people are more interested in coming forward for treatment to address other issues, whether that's mental health issues. So there may be some apps out there that are for mental health, but would have, a component looking at maybe alcohol, smoking and other drugs. I'm not familiar with the youth ones. The other population was comorbid depression and
ADHD.
And comorbid ADHD and cannabis. The only cannabis specific one I've come across is the one I mentioned today. I've forgotten. Is it
the weed, the quit weed? Is that how? Yeah. And that would be a really good one, I thought, to use to sort of support a young person. And I think the thing, apps that are sensitive to the sort of neurodivergent sort of elements of ADD and other issues is that it allows you to sort of go in and out of them. And, it's not like you're stuck there having to talk to a therapist. So being able to use something like that as an adjunct, I think would be really, really helpful.
Thank you. Do you recall whether that one was a free app?
Grounded? I think that was the one that's at $8 or so a month.
Thank you. Sorry, the person asking was hoping for a free app for this.
Yeah. If you want to, we could probably find someone to do a bit of searching for us. If you want to, I have 200 people all emailing us, but this is Vic's going to but it'd be good for us to also think through about some more youth specific ones. I suppose Vic and I both work in the adult space, but please contact us and we'll see if we can help. Yeah.
Thank you. One of our attendees has just said that the Quit Weed app is free.
Oh, there you go.
Oh, well, there you go. Good.
Just a comment here. I'm keen to see an interactive app that brings the consumer out of session connection to the clinician, providing feedback on experience of strategies they may be trying and allows for in-between session updates. Thank you both for a wonderful presentation. I'm wondering whether you could comment on the magnitude of clinicians that are currently using apps as a part of their practice. Have you had any discussion with or received feedback from clinicians on using apps as adjunct tools to treatment?
Vic, I don't know if we did run a workshop with, Vic's already said, with addiction medicine specialists, and I think maybe only a quarter. I think when we did a quick sort of discussion, it's funny you should say that, because Vic and I are planning to do a study on this, because we're really wanting to understand, I guess, the sort of what types of apps that clinicians might find useful, and what some of the barriers and what are some of the sort of challenges around using apps and what would be helpful to know, etc. So watch this space. We'll tell you soon.
Thank you. Out of all of them, are there any particular substances or behaviours in which apps have shown to be most effective in aiding the recovery of addiction from?
I mean, almost, I'd say probably 70% of the apps are targeting alcohol. And even the ones that claim to target all substances have really built from the foundations of targeting alcohol. So that's where the most evidence is. Smoking, though, there's more and more smoking apps. I didn't cover it today, but there's been a just-in-time adaptive intervention trial of a smoking app. I think it's called QuitSense. That was in the UK, and that showed, we all know it's incredibly hard to actually quit smoking, but incredibly important. And they had, I think, 4 times as many report that they'd quit 6 months after using this AI sort of driven app, which essentially looks at with the senses where you are, how you're feeling, and delivers an intervention based on your own sort of individual circumstances. So that had 4 times the number of people who quit smoking at 6 months compared to a control group. So I think we are going to start to see more and more, the stronger evidence for these apps for other drugs other than alcohol.
Thank you. Are there any apps currently available that have geolocation functions, e.g. for gambling?
I don't think the ones here have the Gambling Less and the Gambling Habit Hacker and the Gambling Less in the moment. I don't think they have geolocation sensors, but they do exist. I think a lot of them, you have to go to the app stores, and they say they're available in Australia, but sometimes they're not, or you might have to pay for them if they're really on the US. If they're advertised in the US, they may or may not be available in Google Play or the app stores here.
Thank you. A question in relation to the Swipe app. Is that related to influence on the reward centre through the point accumulation? Can you discuss further how it has been effective?
Can you repeat the question? Sorry, Beth.
Yeah. In relation to the Swipe app, is that related to influence on the reward centre?
Yeah, that's it. Yeah. Okay. Well, I can happily answer that question. The idea is that we're reducing that cognitive bias to alcohol cues. And one of the theories, although it's meant to sort of do this implicitly, as in you're sort of not aware that you're being trained, really the thinking with cognitive bias modification more generally now is that it is a more conscious change in sort of the value that we ascribe to stimuli. So in that sense, it probably is changing the reward system in that we are devaluing alcohol cues. The very action of pushing something away has been associated with a devaluation of those cues. So yeah, it probably is doing something there. And the thing that we love about Swipe is that rather than being trained to repeatedly approach non-alcoholic cues, we're actually sort of strengthening people's motivations for behaviour change or reduced drinking. So by using pictures of their family or their goals or their hobbies, activities that they'd like to be doing more of instead of drinking, we're trying to reinforce positive behaviour change, but also maybe increase the reward ascribed to those non-drug rewards or those non-alcohol rewards. That makes sense?
Is there any information on who these are most relevant for? In particular, do we know if they can be effective for people with more heavy substance use compared to moderate use?
It's a good question. I suppose I thought originally when I was first working in this area that it would be more sort of moderate use, and we certainly don't necessarily recommend them for people with really sort of, someone who really can't go without drinking for the day or has, drinking really early in the morning, those sorts of signs. Obviously, they need, much more support than an app. But we have found that some of the people who've just come along to the trials, we haven't recruited them specifically, do have very heavy use and are able to sort of reduce during the time of using the app. So even though it's not what we necessarily target and focus on, I think some people do benefit. But I think the important thing is someone with a really heavy dependent use needs that wraparound system around medical support or detox or other elements as well. I don't know, Vic, if you wanted to.
Yeah, I mean, the studies are usually quite limited in the outcomes. By the time, because of the attrition from the trials, we end up, it's not unusual to have, say, only 30% of your sample reporting on the outcomes. And there's no scope then for doing any kind of mediation or moderation analyses to work out for whom it's benefiting the most, because you're just so limited statistically in terms of power to detect those changes. So it's not, I mean, I would say that, yeah, as you said, Petra, in addition to other forms of support, I think it can still help people with quite severe substance use disorder, for example.
Thank you. Do you think there is potential for these types of self-help apps to cause harm or negatively impact substance use? Are there any risks to giving these apps a try?
I think the risks are fairly small. The only one I think Vic mentioned around, like if the person, say, for example, you've got a case scenario of an individual who's highly dependent and has obviously a substance use disorder, and then stumbles on an app that sort of, helps them with a few strategies, but really doesn't help that much. But that sort of keeps them from, perhaps prevents them from actually seeking help because they, have got a sort of step in the right direction. Then that's the one scenario that I would imagine is not particularly helpful. In terms of, say, an app that is harmful. Unless, even if an app that focused on a very punitive approach or something would be really unhelpful. But I guess that's where we've recommended in our presentation is that you're familiar with the apps that you're recommending, that you use, government-backed or research supported, university supported, or as reputable. Like I know that there's a nice app in the UK by the liver. I'm blank here. I think someone in the audience who's come along knows who I'm talking about. But it's the Liver Support Association. It's a really nice alcohol app. So a lot of these associations are starting to build that. So just do your homework and have a look. But if it's got a reputable developer and source, I really can't see that you're going to do any harm. I know it is a concern but if you integrate them with the work you do, rather than just sending someone out, then I'd be fairly confident that you're in good hands.
Thank you so much. Apologies to everyone. I'm just aware of the time. We're not going to be able to get through all of the questions. Might leave it with a more positive comment. The tracking feature gives the possibility of celebrating achievements, as Petra says, about a strengths-based approach. A mentor once said, "What's right with you is the starting point. What's wrong with you is beside the point." These apps open the possibility of focusing on what's right with people.
No, I like that. It's a great expression to end on.
Yes.
Use that.
Yeah. I mean, as with anything, just to sort of say, they're not a panacea of, they're really another tool in your toolkit.
Yeah.
Absolutely. And thank you so much for your presentation. And just a reminder to everyone that the slides will be sent out to you, and the video will be on our website in the coming weeks. Thanks again.
Thanks, everyone.
Thank you. Bye.